So today we have Dr. Nikki Philbrook here to kind of give an overview of the program, and then we're happy to answer any questions that you have about the program. My name is Sarah. I do digital communications within the Bachelor of Health Sciences, and Corey Semble is also with us, and she is our student experience coordinator. And I'll turn it over to Dr. Philbrook now.
Thanks, Sarah. So I will just say that this presentation is fairly on-campus health science focused, but that's not to say that we can't answer questions related to the online health sciences program as well if you have them. So please just let us know if you have any questions that I haven't addressed. So today we're going to be talking about the Bachelor of Health Sciences program, and hopefully throughout this presentation I'll give you not only an overview of our program focus and how we've designed the program, but also the application process and how to best kind of approach those applications. So the health sciences program here at Queen's focuses on human health all the way from molecules to populations. So we are looking inside the body, inside our cells, but we are also kind of scaling up to tissues, organ systems, the whole individual, and then our social determinants of health, our global and population health, how our government policies and law all influence healthcare and ultimately health. And so we provide a broad perspective for our students to learn about human health. We also, in all of our core courses and many of our option courses, run them in a flipped classroom or blended classroom format. And I'll go into what that specifically means in the next couple of slides. As well as we have implemented a competency framework, or you can think of it as a skills framework that is common to many health professional programs, which many of our prospective students and current students are interested in applying to once they've completed their health sciences degree. And so just looking a little bit broadly at the health-related programs we have here at Queen's. So there are a number of them, and with respect to human health, all with a bit of a different focus. And so you can see that health sciences is situated kind of right in the middle here, balancing between the biomedical sciences, where we do allow our students to kind of have a really strong fundamental education within the biomedical sciences, as well as stretching across to the right-hand side of the screen into the social determinants of health and some of the other I mentioned. We do also have a biochemistry and life sciences program here at Queen's that would be tipping more towards the biomedical sciences side of things, as well as a kinesiology program and actually a Bachelor of Arts program called Health Studies that really kind of tips towards the social sciences. So lots of opportunity to explore human health at Queen's, and hopefully one of these programs fits well with you. So within the health sciences program, we do allow students to focus their degree, and they do this through applying for or registering in a variety of different learning tracks. And these are entirely optional learning tracks that our students can engage in. They don't have to. And actually, we allow students to engage in more than one if that is something that they desire to do. So there's a good amount of flexibility related to these, but what they are a collection of courses that allow you to kind of focus your degree in a particular direction. And that would end up leading to a specialization kind of statement on your transcript itself that would indicate, for example, that you did an option in global and population health. So a really common question that we get, of course, is what is a flipped classroom? And I think this is a very logical question because it's a little bit funny. And so what we do with the flipped classroom format is flipping the kind of traditional lecture format on its head, where in a lecture you would expect to come to class with minimal preparation. You would sit in class and passively receive information from somebody standing at the front of a room, and then you would be expected to go away and kind of extend that knowledge into your assignments. In a flipped classroom, we actually provide some kind of introductory concepts and fundamental information to you prior to arriving in class. And we do this through the use of interactive online modules. So these are collection of information that your instructor would have put together for you. And so not only reading, but also some videos or some interactive diagrams. Maybe they are walking you through a slide that introduces a tough concept, but it provides you the opportunity to really learn and solidify these new concepts prior to coming to class. And in class, often at the beginning, there would be some sort of small stakes formative assessment, a readiness assessment, just to make sure that our students have come to class ready to work. And then during class, it's really using those concepts that you learn before coming to class and applying them to various things within class. So you might be working with a group of students or with your instructors and TAs to solve problems, perhaps tackle some case studies, maybe develop a research question. Depending on the class, it would look pretty different, but consistently what you would be seeing is the application of that information that you learned before coming to class to a problem sort of scenario within class. So what are the core and option courses that you'll be taking within each year? And so you can see right from first year, you're taking very health sciences focused courses. And so things like pharmacology, human anatomy, human cell physiology, as well as history and philosophy of health and healthcare, social determinants of health, and a statistics that was designed for the health sciences specifically. And so you can see through those core courses that there really is that balance between biomedical and social science aspects of health sciences. We also have a number of option courses that students can pick from. Some of these include, but are certainly not limited to, the science of mental health, well-being, and resiliency, understanding human diseases in the 21st century, as well as courses like general chemistry, psychology, etc. So typically across each year, you would see a student take 10 courses or 5 full year courses. So all of the core courses in the health sciences degree are half year courses. So in first year, you would have 3 core courses in the fall, 3 core courses in the winter, space for an option in each term and an elective in each term. In second year, we continue to try and provide a bit of a balanced perspective on health sciences. So you'll have a full, so 2 courses in human systems physiology. You'll be introduced to biochemistry, global and population health, research methods, and then you need to choose between an immunology or a microbiology course. And then some of our second year option courses that you can choose from to fulfill your requirements are courses like racism and health in Canada, molecular biology and organic chemistry, interprofessional practice, an antibiotic resistance lab, or a human physiology research course. Carrying on in third year, our core courses are reproduction and development, health ethics, law and policy, human pathology, genetics and genomics, and pharmacology. And then some of our options that students really enjoy taking are evolutionary biology of cancer, integrative laboratory course. You can choose any number of courses, and you'll notice we cannot fit the whole curriculum, particularly for third and fourth year, on a slide because the option numbers increase as you increase in years, and the number of core required specific courses decreases as you go up in years. And so you'll notice by fourth year, there's only 2 core courses that are required of you. So it's Advanced Global and Population Health, as well as a Developmental Origins of Health and Disease course. And then I provided a few of the different option courses that you could choose from here, but there is a much longer list than what I could provide on the slide. And it's really as you get into third and fourth year that you're able to follow the courses that really speak to you the most based on your experience in earlier years. Another question that we often get is, does Queens have a co-op or internship option? And so Queens does prescribe to the internship model of experiential learning. And this is run through a Queens-wide organized group that runs optional 12 to 16-month paid professionally supervised internships. And what this means is that you would essentially take a bit of a rest from your academic studies. So you wouldn't be taking your third year pharmacology and genetics courses, but you would go out into the workforce and participate full-time in a professional position under the supervision of somebody and really gain experience in what it's like working in the field that you choose. You do continue to remain classified as a full-time Queen's student throughout your internship, and you do take some internship courses, which reflections and performance reviews with your supervisor in your internship. And then you would come out at the end of your degree with a transcript and a degree that says professional internship on it. We do often get asked about research opportunities as well. And over the course of the 4-year degree, you'll see a bit of a shift in how research is introduced to you. And so in first year, you would typically have your research embedded within some of the courses that you might be taking. And it's not so much conducting independent research as learning some of the basic laboratory skills that will help you potentially engage in research in the future. So some courses that have this option are our anatomy class, as well as the first year chemistry course that many of our students take. In second year, you can register in some option courses that really allow you to immerse yourself in research a little bit more. So all of the class time would be within the lab, and some of our options in this regard include an antibiotic resistance lab as well as a human physiology lab. It does allow you to explore kind of how to approach research and research questions a little bit more than what you might see in first year, but it's still fairly guided and prescribed. But beginning in third year, in addition to some integrative laboratory courses that are similar to the second year ones, though more advanced, you could start to engage in independent research under the supervision of an expert in the field. Not all of our students start this in third year, but many of them are keen to do so. You can also leave your independent research if you're wanting to do it to fourth year, or you could do it in third and fourth year, or you might not really want to do research at all, and that's okay. And you can just take the courses and maybe get some experience through some of our other experiential learning opportunities like QUIP, or the internship program, or our global health practice course, which is a fourth year experiential learning course as well. So I mentioned a bit earlier about competencies or skill development, and this is something that we've woven into each of the courses that we offer to our students as part of the health sciences program. And through our assignments, so whether it's a debate or an essay or a poster presentation or whatever it might be, we have worked into the way that you're assessed, that you will be assessed on the development of specific skills. And you can see on the right what these skills are that you'll see repeated throughout the different courses. So while engaging in the courses, you'll learn how to be an effective collaborator and communicator, an advocate, a leader, etc. And what this will do is through your time in the program, you will kind of develop a bank of examples that you can use as a time when you were an effective leader, or you advocated for something you believed in, or you communicated really effectively in a particular way. And those are the sorts of questions that you could be asked on a application for a professional program or during an interview for a career. These are skills that are transferable across disciplines, and we feel is very important for our students to develop throughout their 4 years. So this is a large number of possible career paths, but we have students in our program that are interested in a number of different opportunities after they graduate. And I will be honest with you that many and most of these will often require further education after your 4 years. 4-year degree, which I know at the beginning of it can feel a little disheartening, but it doesn't have to be a linear path. Lots of people finish their degree, they get some work, they maybe better understand what their interests are, and then perhaps return to training to help them get to the career goals that they're hoping for. So we do, of course, have a lot of students who are interested in medicine, but by no means that's the only career that students are interested in. And I feel that as an advisor, each time I talk to a student, I'm learning about different programs and different career opportunities that exist. So I think it's an exciting time to be entering and learning more about the health sciences, only to find out what careers could be possible for you in the future. So hopefully, after hearing this whirlwind introduction to the health sciences program, you are now wondering how you can apply to it. And so our applications are open currently for the on-campus program through UAC. And you would first apply, and then you would gain access to the Queen's application portal, which would then ask you to fill out an optional equity self-identification form. You would be asked to complete your supplementary application, which is required for the health sciences program. And I have more to say on that on the next slide. And then keep working hard. It's a fairly competitive program, and we want to make sure that, or you will want to make sure that you're putting your best foot forward on your application. So keep trying hard in your high school courses, and even after you apply, we keep getting updated on your grades as an institution. So you'll want to make sure that you keep striving for success. So I mentioned that we do have a required supplementary application, and this must be completed in order to be considered for the health sciences program on campus. And so you will, once you are logged in to the Queen system, you will be randomly assigned with 3 questions, and you'll need to answer 2 of them. They are essays, I say in quotations because they're about 2,000 characters. So this is like a long paragraph. And you're given 1 month to complete both of those. So it's not instantaneous answer that you're required to provide to us. We want you to read the question and reflect on it. These questions are really based on our wanting to get to know you. We have a lot of really strong applicants to the program, and we're limited in space. And so we want to better get to know who you are through the supplementary application, as well as better understand how you think. And so I will direct you to our website the BHSC or just bhsc.queensu.ca. If you go to prospective students, there's a supplementary application tab that you can click on, and we do actually provide our rubric, our scoring rubric that we use to grade these essays right on our website for you to see, and that's what we use to grade it. So it's really important that you take a look at that before you complete these questions. So that's the end of the formal part of this presentation. I would, of course, be very happy to answer any questions that you might have. One thing that I should have included, and I am sure will be a question, so I will provide the answer up front, is competitive average last year was probably approaching mid-90s. The supplementary application is very important so we can try and balance both grades as well as our applicants as individuals. And we aim to have around 230 people, new students entering the health sciences on campus program in first year this upcoming year, as well as an additional 35 at Bader College, which is our castle that Queen's has located in England, and a small cohort of health sciences students can start their degree there, and then they would return to campus for years 2 to 4. Okay, so with that, I will stop sharing so I can see what's happening. And yes, very happy to answer any questions there might be.
So for those wishing to ask questions, you can pop your questions in the chat. I have a couple that were sent to me by direct message for you. Everyone else can kind of start putting any questions they have in the chat, or feel free to use the raise hand feature on Zoom if you'd rather ask your question out loud. So first question, what type of students are successful in the Queen's Health Sciences program?
That's a good question. So I would say, we have a good variety of different students and different learners in the program that all find their way of being successful. We do find that students who have a self-motivated nature, so people that are able to keep to a schedule, develop a schedule, work well with their group members. We have elements of group work in essentially every class that we offer, and you will always succeed more if you are collaborating with your peers to achieve a finished product. And so we find students who are open to learning new experiences, interacting with new people, really strive to, who have a strong desire to succeed through collaboration, really do find the best success within our program.
Do I have to apply separately for the on-campus and the online program?
So technically, yes, they would be different codes in UAC. So there would be QH and QHO. For the online, historically, we have for individuals who have not been offered a spot to the on-campus program, and if they reach the benchmark, will have been made an offer to the online program instead. But I don't know if that is going to happen for sure every year. So I wouldn't want to bank on that, is my suggestion.
What is the most popular career that BHSC graduates pursue?
Great question. We have not, so as an on-campus program, we have our first fourth year cohort currently. So we have not had like a full blown graduating cohort yet. So it's always a difficult question to answer. We have had more of a trickling of graduates from our online degree program, and we see a really, really wide variety of people going into graduate work or professional programs, some going into government organizations. I will say that many of our students are interested in pursuing medicine or another professional program, but by no means is it all of them. And I think once you're within the health sciences program, you start to learn about a lot of different career opportunities in the health sciences that exist that you maybe haven't been exposed to before. And that's our job, to help you realize that there's a lot of variety here, and it takes all kinds to kind of make a healthcare system function.
Is there anything that Queens does to help students prepare for the MCAT?
So yes and no. So we have courses that a lot of our students take to help them prepare for the MCAT. So chemistry, organic chemistry, biochemistry, English, psychology, et cetera, are all courses that are either in our options that help you fulfill your requirements for the program, or you could take them as an elective. There are also a number of external organizations that run MCAT preparatory courses and study groups and support groups for the MCAT. They are not offered by Queens specifically, but they are often run at Queens by external organizations. So there will be opportunity for you to find supports for the MCAT within the Queens community.
How much of an impact do grade 11 marks and midterm grade 12 marks have on an applicant's consideration?
So they will have a fairly strong, at least initial, sorry, my children are driving home and I'm going to get distracted. Okay, let me start over. So the grade 12 midterm marks are likely to have a stronger influence potentially than the grade 11 marks. And it really comes down to our offers and when they tend to go out. The health sciences program historically, and I can't speak for certainly what will happen this year, but in the past, we have not sent out most of our offers until after grade 12 midterm marks would have been submitted to UAC, so that we can make the most of the offers based on the most grade 12 grades we could possibly have. So grade 11 grades will, on some occasions, influence or play a factor in applications, but as much as possible, we do try and use grade 12 grades. That's not to say that, like, don't fret if you don't have a prerequisite course until winter term. That will not negatively influence you in any way.
How many programs can I apply through OUAC to Queens? I heard I can only choose 3 programs at Queens, but would I be able to apply to 5?
This is where we wonder if we should have brought an admissions coordinator with us. So I don't know the answer to that explicitly. I was under the impression that you could apply to 3 for like a very specific fee, and then you could apply to more by paying more, but that could be very outdated information. So I will suggest that you reach out to admission@queensu.ca to ask that question. Thank you, Corey.
Does Queens give alternate offers?
Alternate offers being, so it really, we have in the past, but it's not something that is like prescribed that should be banked on. So I mentioned in the past, we have had circumstances where if students are not offered the on-campus health sciences program, they might be offered the online health sciences program. It really is influenced by the number of total applicants each program gets each year. And so it's not something like, if we have the ability to do that, we will hopefully be able to do that, but it's not something that is set in stone.
Are there requirements to apply for an internship after the third year? And when would a student apply for it?
I'm going to start talking, Corey, and then you just jump right in if I say the wrong thing. So most typically students apply for an internship during their third year to take it once they've completed their third year, but you are eligible after second year as well. You do need to, so there are a couple of, I think, eligibility criteria. So you need to be in good academic standing. You need to have completed a certain number of Queen's courses. You need to, I think there's probably like a residency, like permanent residency or Canadian citizenship requirement potentially. And then,
yeah, you need to be eligible to work in the country of the placement
that you're applying. And then you need to return to complete your degree at Queen's after your internship. And those are the major ones I can think of, unless Corey has another on her mind.
Nope, you hit all the points. 1.8 GPA, return to your studies, second year standing to join the program, and then also you need to complete 3 workshops through career services before you are to start your internship position. But really those workshops are really just to help you write your resume, search for an internship, and to prepare you for potential internship interviews. So very helpful stuff you would want to complete anyways.
If I wanted to go into medicine, what kind of work experience could I get through QUIP?
So yeah, so the internship program at Queen's is a like Queen's wide, almost like a job board, basically. So you would be able to go through all the internship positions that are partnered with Queen's and choose the one that you think fits you and your desires, interests, goals best. And so as health sciences students who have engaged in research opportunity, or sorry, in internship opportunities, we've had students who worked at the Bank of Montreal, and they needed a bit of a break from kind of the day-to-day health sciences stuff, but they were able to apply a lot of the data analysis and research kind of strategies to their internship in this more typical kind of office environment. We've had an intern who went to the Cardiac Research Institute, something like that, in Ottawa, and do more of a research-based internship. And we've had somebody who has worked at Indigenous Services, which is a governmental organization, and has actually, I think, been offered a job as a result of that internship because there was such a mutual love of that position. And so it really is kind of what you want to do with it. There are certainly some internships that are health sciencey in terms of sometimes research, sometimes government, non-governmental organizations in health sciencey fields, perhaps a good number of internships with some of the life sciences students who I've worked with have done kind of pharmaceutical sort of internships. So if you're interested in health science related ones, they certainly exist, but we also really encourage you to explore some of the ones that you might not initially catch your eye, because the skills that you can learn from a lot of those internship opportunities would be transferable to medicine. Those competencies on that competency donut, as I like to call it, communication, collaboration, leadership, professionalism, those are all the same as the CAN-MEDS framework. The CAN-MEDS framework is a competency framework that our medical schools use. And so if you are able to demonstrate that you are professional and a leader and collaborative in any environment, that would be very transferable to medicine.
When do acceptances start going out?
That is not yet decided, but so historically they do go out kind of late comparative to a lot of other Queen's programs. I think last year, most of our offers went out after March, and they will be offered until mid-May. We do on occasion send out a few early offers, but not typically. So don't fret if you don't get an offer early.
I know you answered a bit about the supplementary essay, but I wanted to know what you are really looking for. Can you give us a few examples of the essay prompts?
So what we are really looking for is on the rubric that is on the website. And I know that's an annoying answer, but it is very accurate. Like, we have that rubric open as we're reading each essay. And so if you feel that you are in the exceptional category in that rubric, you're probably doing pretty well. So as I said, it's a fairly reflective, let us get to know you sort of question. And so there might be some where it's, tell us something about yourself that, I don't know, you feel is unique, or tell us something about an experience that changed the way you approached, I don't know, your community or your ideal. I don't know. Like, it's very like wide sweeping. Tell us about yourself and how you are able to kind of connect different experiences, learn from your experiences, look at yourself and your position in your community and society, and reflect on how that might affect the way you are living in your experiences. That sort of thing. Does that help? We'll never know. Hopefully it does. Yeah.
Will taking physics increase my chance of getting into the program?
If you do very well in it, it might. So we will not be, looking at physics explicitly. The requirements are, so chemistry, biology, any 4U math, 4U English with a minimum of 80%, and then 2 additional 4U or M courses. So those would be kind of your next highest 4U or M courses. So if physics was your next highest 4U or M courses, then could be helpful.
What is the average class size?
So as I mentioned, our incoming cohort, we are hoping to have 230 students. So our core courses are typically we divide that 230 into 2 sections. So it would be somewhere just over 100 in our core courses. And that within the class environment is broken down a little bit more. So oftentimes you're working in a group of 8, you're working maybe 3 or 4 groups of 8 are working with 1 TA. And so what's always a little bit funny to hear is our first and second year courses being like, oh, I love how small our classes are. And you're like, but you have 100 people in it, but it feels a lot smaller than it sounds like it is. If you're taking some option courses or elective courses that are offered by the Faculty of Arts and Science in first year, they will be bigger typically. So that would be more of the typical lecture style class where you might have a class of 300 or 400 students in it, but you would be having tutorials or labs that would be with a smaller group. I think I feel like chemistry tutorials, for example, might have, I don't know, 50 to 100 or so in a section. And then as you go up in years, typically the class sizes do get a little bit smaller. Some of our 4th year courses would only have classes of around 40. So it changes by year and it changes by what course you're taking, but you can kind of bank on your core courses always being probably around, like it would be the size of your cohort, but then sometimes divided into a section. So maybe 100 or so.
How many applications do you generally receive?
So last year we received just around 5,000 applications. So it's competitive, which is why we tell you to keep working hard and tell you to do your supplementary application.
Who reads the supplementary applications and how many reads does one application get?
So we have a group of individuals, both within the Faculty of Health Sciences as well as outside, with a fairly diverse kind of profile to provide as much perspective as possible for our readership. Last year, I believe we had around 15 to 20 readers who all underwent training with the Get Real movement and training, kind of an internal calibration training, I'll say, where we are all discuss grading and make sure we're grading on a fairly even tone. What we do is we distribute the applicants. So you're graded as an applicant rather than as an essay. And so your 2 essays would go to 1 reader as your application, all anonymized. We wouldn't know who you are. And it goes to 2 separate readers who would then score it. If there's a large discrepancy in that scoring, it would be sent to a 3rd reader as a bit of a tiebreaker. And then we have kind of our reader admin that kind of reviews all scoring ahead of time before we work with admissions to make the offers. So it's a fairly intense and time-consuming process that we take very seriously, because we want to make sure that we are giving everyone the shot they deserve at getting in the program, and we know there are so many deserving applicants that we want to respect all the applications that come in as much as we can.
Is admission based only on grades in the supplementary essay, or is there anything else such as volunteer or work experience that is considered?
So no, it's primarily based on grades and the supplementary application. It is always helpful to have an extracurricular or a volunteer or a job or some sort of activity that you engage in to be able to draw on in your supplementary application. You will find it easier to answer a number of those questions if you have something to talk about, but we're not looking for any sort of prescribed something. I will tell you that the people that try and twist whatever question they've been given for the supplementary application into a list of extracurriculars, it does not work out well for them. So please answer the question as it's asked. And if you find that you're only talking about one experience or activity, that's okay. That's good.
Do I access the supplementary essay questions after I submit my application to OUAC?
Yes, I believe that's how it works. So my understanding is that you need to submit your application. You would receive your kind of login information from Queen's so that you can enter our online student center Solus, and then that's where you would be able to access the supplementary application.
What is the ultimate decider, marks or the supplementary essay?
Great question. It truly is a balance. I will say that if you are in the like upper echelon of grades and you have a 99.9% or something similar, like grades might balance a little bit higher. But what happens is we look at our applicant pool as a whole, and we then work with admissions to determine, based on our capacity to read the supplementary essays, what the threshold is that we'll be able to read our supplementary applications above a certain grade. And I can't tell you what that is. It changes each year. And then essentially grades no longer matter, and we're only reading the supplementary applications and go based on the scoring there. So it's important to kind of reach that threshold, certainly, but then it's really important to have a really strong supplementary application.
When do you start reading the supplementary essays?
Wouldn't we like to know? Yeah. So I don't know the answer to that. It's like an ongoing conversation with admissions fairly constantly. They're kind of the holders of the information, and they send it over to the readers, and then we send it back to them, and it's kind of a process like that. So typically, historically, I'll say we have not started reading them until the new year.
On the website, it says the supplementary essay is available on November 1st. So would we have to submit our application before then in order to access the questions?
Yes. If you wanted to access the supplementary application on November 1st, then I believe you would have to submit your UAC application by then. It is open until February, and your UAC application, I believe, closes before February. So there's a bit of a staggered start. So you don't have to access the supplementary application on November 1st, but you could if you had applied already.
What was the threshold last year? I believe
I knew that was coming.
Yeah.
I actually don't have that number in my head. It was in the mid 90s, close to mid 90, but I don't have the specific number in my head.
We're getting close to the end of our session here. And I don't have any new questions for you right now. We'll give everyone kind of last minute or so to type in any final questions, but otherwise we'll start wrapping up. So I'll give everyone a second. Awkwardly stare at the screen. Okay, let's just start wrapping up then. Thank you, everyone, for joining us. We really appreciate it, and we hope that this provided you helpful information to help you decide if this program might be the right fit and help you feel more confident going forward with your application if you do feel like it's the right fit for you. The recording will be posted on our website. So keep your eyes out for that. We also just posted today a recording of the differentiating different health focused programs at Queen's info session. So if you're kind of trying to figure out what the difference is between all those different health related programs, that is available on our website as well. And it's very useful to kind of see the differences and similarities. Other than that, have a great evening, morning, afternoon, wherever you're joining us from. And thank you, Dr. Philbrook and Corey, for helping out today. Have a great one.
Thanks, everybody.